Recall that inside of the heart, there are valves that create unidirectional flow. And there are four valves that we talk about. Okay? There are two atrioventricular valves, so those separate the atria from the ventricles, so atrioventricular valves. And then there are two, what we refer to as semi-lunar valves, and these separate the ventricles from the major vessels that exit the ventricles. So if we sort of draw a very generic heart, right atrium, left atrium, right ventricle, left ventricle, like so. Okay. I'm going to draw that like this. Okay, now remember that coming out of the right ventricle, this is my right ventricle, put right ventricle down here, right? There is a major vessel that comes out. I would go back here and then come up this way. Okay, and then it leads to, this is what we refer to as our pulmonary trunk, right? Because the right is going to send blood to the heart, or to the lungs. And then coming out of the left ventricle, we've got a major vessel. And we'll sort of draw it like this, I guess. Like so. And this is our aorta. Okay, now if we look, right, we have a valve. I'm going to sort of erase a little region here and here. And I'm just going to redraw this just a little bit, make this a little bit better here for us. Like so. And there is going to be a valve here, and it'll be a valve here. Okay, so we have our right atrioventricular valve separating the right atrium from the right ventricle. We have our left atrioventricular valve separating the left atrium from the left ventricle. Okay, so we have over here, let's just sort of draw these here. We have a right AV valve. And I'll put in parentheses tricuspid, because some people like to call this the tricuspid valve because it has 3 leaflets on it, if you recall. And then we have our left AV valve. And I'll put bicuspid on this one because some people like to call this one the bicuspid. Or let's even put mitral valve too, because some people like to call this the mitral valve. Lots of different names. Okay, but those separate the atria from the ventricles. Then, and let's do purple, right? We have sort of a valve like this, something like that, that separates the ventricles from the major vessels. So you have the right semilunar valve, which separates the right ventricle from the pulmonary trunk. This is known as the pulmonary valve. Okay. And then you have the valve that separates the left ventricle from its major vessel, which is the aorta, and this is known as the aortic valve. Okay. So these are the 4 main valves that we talk about, and it's these valves that actually create the sounds that you hear when the heart beats. When you listen with a stethoscope, you'll often hear these referred to as the lub-dub sounds. We'll call this lub-dub. Okay, and your lub is your AV valves closing, and your dub is your SL valves closing. All right, now let's take a look at how these valves work for a minute, because that's going to be important for a little bit later on. And I am just going to draw 2 very generic chambers. Okay, and they're going to be separated by a valve. It looks like this. Okay, now you can consider this to be any valve, whether that be an AV valve or a semi-lunar valve. It doesn't matter. They all sort of work the same way. Okay, now what's the way that they work is that when there's a force in this direction, notice how I drew these, right? Sort of curved in this manner. When there's a force in this direction, right, these things will sort of open up and move like that. Let's just draw another chamber. It's the same thing over here. Like so. But now let's imagine, right, that we sort of contract this chamber here, and that those valves, right, are going to have force in this direction. So what's going to happen is that that valve is going to get moved up. So it's going to get pushed in this direction, right? It gets pushed in this direction and that valve closes and it sort of snaps shut. Now, this is fluid inside of here. We have blood inside of here, and these valves are made up of the endothelium and some connective tissue, right? And so there's going to be fluid, and when they snap together, right, they sort of get stuck together. So imagine you give like a 3-year-old a balloon to try to blow it up. Now, what's that 3-year-old going to do? It's just going to get spit and saliva all inside of that balloon, make it gross. And then what's going to happen when you go to try to blow it up? Right? Those hydrophobic interactions, right? Or the interactions between the water molecules create that surface tension, and that's hard to break, right? And so because of that, when these valves sort of come together, they don't come apart very easily. It takes a little bit of force to push them apart from one another. Okay, so now if we think about this from the aspect of the atria and the ventricles, so let's say our atria here, and then we have a big ventricle. Okay, then we've got our, let's put our valve in there. Okay, we have our valve like so, and let's put this valve shut. Okay, because this, let's say this ventricle contracted, it shut this valve. Okay, now let's say this ventricle is expanding. Okay, now as that ventricle expands, okay, there is going to be blood up here in this atria. And the blood's going to exert a little bit of force on those valves, but it's not going to be enough to pop them open, right? So what needs to happen is this ventricle needs to sort of expand in size, and if we increase the volume of that, right, we increase the volume, that's going to lead to a decrease in pressure. So we're going to create negative pressure in here, and that's going to pull these open, okay? Now, if we think about this, let's look at it from the ventricle. So here's our ventricle, and then a blood vessel outside. Now, what's going to be a little bit different is where the valves form or flip up. So they're like this, okay? So what's going to happen is as this ventricle relaxes, right, what's going to happen? It's going to pull this direction, and then the blood that's up here in this vessel is going to push this way, and that valve is going to sit shut. Now, if we reverse that, let's say we reverse it, and now all of a sudden our force is in this direction, right? What's got to happen? We have to exceed the force that's being pushed down this direction, because we got to force this direction by the blood, right? And then we have a little bit of interaction between the walls of the vessel that we need to overcome. Okay, and so once we do that, once the force exceeds, then we can pop it open. Okay, so when we look at valves, and this will be kind of important when we look at the cardiac cycle, we need to think about how are these valves operating and how are they opening and closing.